Locum Tenens, I think, had started out as a way for physicians to reduce the amount of hours that they were working, to consult back in a contract capacity into some of the environments that they'd worked in before. We're really seeing an evolution within the physician workforce, where the work-life balance, the focus on the peer delivery of healthcare is really driving interest in locums, because it is a model that provides a lot of flexibility and in many cases allows a resolute focus on the simple delivery of healthcare rather than some of the more complicated and at times political aspects of being part of a system or part of a physician group.
There are, different situations and different needs with different clients. Sometimes you have a client that, is in a very remote area that maybe they don't have, we're going to provide the only doctor that they have in their town. And so, that's the kind of reward that I get out of this job, is being able to help a situation, help a small town with a provider that maybe they wouldn't have had any medical care or any providers working in that town.
I think that clients specifically are going to want someone that's going to give them more than just the minimum, hey, do you need a provider for coverage? They need somebody that's going to give them information on the marketplace, consult with them about different trends and drivers that would affect their business.
Well, I think planning ahead, and if the clients know, we use a locum tenens provider every year at the same time. There's also different flu season, those types of things where we can have providers go in whenever there's a heavier patient volume versus just if they've lost a provider. So there are different ways of using a locum tenens provider. Just then, it's an immediate need and we need somebody right now. So there is to see excess patients.
One of the things that we're working with some of our strategic customers on is understanding the entire revenue capture cycle and making sure that we're aligning our contingent workforce with their expectations. And so there are things that we can do from an onboarding perspective so that when the physicians come on site and are delivering care, they're better equipped to with the paperwork, with the administration aspects of the system that they're entering, so there isn't such a steep learning curve. And this allows them to be much more productive faster and allows the healthcare system to capture more revenue more quickly.